Hey guys, Dr. Heimlich here, and today we're going to be talking about a huge treatment mistake to avoid with fibromyalgia. Now, one of the biggest mistakes I see with patients not getting good results from their fibromyalgia treatment is thinking that they've had all the correct tests done to figure out what's causing their fibromyalgia. Well, usually many of the women that we see in here have seemingly had every test done under the sun. I mean, most of the women I consult with who are suffering with fibromyalgia or any other chronic condition, they've had MRI, CT scans, NCVs, EKGs, basic blood work, psych evaluations, colonoscopies. Now, all these tests, they do have their merit, and they can rule out some very ugly pathology. But here's what I found, is that after spending 2 days at the big diagnostic in the famous clinics, they come out with the same thing they did before they went in, which is a report that says, hey, basically, you're normal, and you've got a diagnosis of fibromyalgia. Well, the truth is that zero functional testing has been done. I mean, research shows that fibromyalgia has a huge neurological component. So doesn't it make sense to have a functional neurological exam if you have a neurological problem? I mean, if you want to get to the bottom of what's causing it, it only makes sense. So what does a functional neurological exam do? Well, it doesn't just look for pathology, meaning heart lesion or stroke. It also looks for subtleties that go on in the nervous system in the brain. It helps to let the doctor know what different parts of the brain may not be working correctly or communicating to each other. Now, if different parts of the brain are not communicating to each other, they call this a functional disconnection syndrome. And this can be corrected without drugs or surgery. Okay, research has shown that you can change the brain with different stimulation. Now, many things contribute to this neurological problem that fibromyalgia sufferers have. I mean, these include gastrointestinal dysfunction, hormonal imbalances, immune dysfunction, dysbiosis, IBS, candida, blood sugar dysregulation, among other things. Now, success with fibromyalgia treatment, it depends on stepping back and looking at all the pieces in a patient's health puzzle. I mean, don't stop looking for answers. You need to find a doctor that's going to do some functional testing on you and look at lab ranges from a functional range. Someone's going to take all those pieces of the puzzle together and put them in a package, come up with a specific plan designed for you to help you end your fibromyalgia nightmare. I'm Dr. Heimlich. Thank you very much.